Imagine getting a severe injury, and instead of worrying about getting help, you are concerned about the bill for receiving medical attention. For many Americans, this is a reality, and as they grow increasingly concerned about bills that are above thousands of dollars for medical help. The lack of affordable healthcare in the country has become severely detrimental to many Americans, and it is an issue we must work to solve now. Today, we will first discuss the issues caused by healthcare expenses. Secondly, we will go over some of the reasons why these prices have skyrocketed. And lastly, we will discuss solutions to make healthcare more affordable. So, first, let's explore the problems associated with unaffordable healthcare in the US, including delayed medical care, rising debts, and declining public health. With rising healthcare costs, individuals have become more avoidant of receiving the medical attention that they need. USA Facts, May 18, 2026, stated that in 2025, 26% of American adults skipped some form of medical treatment because they couldn't afford it. As a result, many people miss out on routine checkups, prescription medications, and even emergency care, all because they don't want to pay the bills. Untreated illnesses can lead to poorer health and ultimately more expensive treatments in the future because they decide to delay appointments that they need for survival. Along with delayed medical care, expensive healthcare also causes a severe increase in an individual's debt. And the Commonwealth Fund, October 26, 2023, conducted a survey in which they found that insurance coverage didn't prevent people from incurring medical debt, and 30% of adults with employer coverage were paying off debt from medical or dental care. This demonstrates that even individuals with insurance were struggling and still are struggling with medical debt. So as these medical debt grows, families may struggle to pay for housing, food, and other necessities that they have around their house and to live. So creating long-term financial stress that can negatively affect their overall well-being besides just their physical health. Aside from rising debts, overall public health is declining with the rise of healthcare costs. And Kaiser Family Foundation, April 30th, 2026, explains that healthcare costs remain at the top of the list of people's financial worries in a survey that they conducted. When individuals are constantly concerned about paying medical debts, they are more likely to postpone doctor visits, which we discussed earlier. When people postpone doctor visits, they end up with worse health. In addition, this financial burden not only harms people's mental well-being, but also contributes to poorer health for many Americans. Now that the serious issues associated with unaffordable healthcare have been apparent, let's take a look at some of the causes for such high costs. So there are three main causes for excessive healthcare costs, including administrative waste, rising drug costs, and advanced medical technology. So as healthcare increases, it's important to recognize that administrative waste is one of the main contributing factors to such inflation. The National Library of Medicine defined administrative waste as any spending that exceeds that necessary to achieve the overall goals of the organization or the system as a whole. This means that healthcare providers and insurance companies are excessively spending money that they don't need to, and this is reflecting on the consumers because they end up spending more money on their bills because they have to cover things that they aren't responsible for. So these inefficiencies increase the overall cost of healthcare, making it more difficult for consumers to receive the medical attention that they need. And it's already difficult as it is. So in addition to administrative waste, drug costs have increased rapidly and worsened bills for many patients. The American Heart Association, April 30th, 2026, emphasizes that the annual price of branded medications is nearly 3 times higher in the United States than in other high-income peer countries. As prescription prices continue to rise, many patients struggle to afford the medications they need to manage chronic illnesses or recover from sickness. And some are forced to skip doses, they delay their refills, and overall stop treatment at some times. which can be extremely detrimental to their health, and it demonstrates how rising costs have contributed to unaffordable healthcare issues. Along with decreased prevention and increased drug costs, the advancements in technology are another factor that contribute to the issue of healthcare costs. The U.S. Bureau of Labor Statistics, December 2020, explains that medical technology can directly increase treatment cost per case by introducing more expensive equipment and medications into the market. Although technological advancements may be helpful in treatments for patients, they also increase the cost of such treatments, thus making healthcare less affordable for Americans who already struggle with medical bills. All right, next. So, after examining the contributing factors for rising healthcare costs, we can now explore some ways to solve this issue. One of the aspects in solving this issue is to include greater transparency of pricing when you're going to a hospital. The American Hospital Association describes that part of their strategy to help lower costs is to ensure that patients understand their benefit structure and available financial assistance across their care providers. So this increased awareness of the costs and the financial help that is available to them will allow them to make better informed decisions when choosing healthcare providers so that they don't have to worry about incurring a lot of debt. So overall, transparency encourages honesty within many insurance companies and healthcare providers and allows people to avoid outrageous bills. All right, and then another solution includes increasing access to preventive care, which allows individuals to avoid serious medical care more often. The Bloomberg School of Public Health, January 29, 2026, explains that only 2 to 3% of U.S. healthcare spending goes to preventive care. And without a greater emphasis on prevention and primary care, the U.S. is likely to see life expectancy continue to decline. By investing more in preventive services such as annual checkups, vaccinations, and health screenings, these individuals will become better equipped with devices that will allow them to prevent getting illnesses. So this not only improves overall health outcomes, but it also lowers healthcare costs by reducing the expensive hospitalizations. Another factor that contributes to rising healthcare is the drug prices. So drug cost containment is beneficial to solution in reducing the spending. And the International Foundation of Employee Benefit Plans, July 15, 2025, outlines a few solutions to the rising prices, one of them being to purchase biosimilar drugs. These drugs have similar side effects and similar effectiveness, and they can be about 40 to 50% cheaper than the drugs that people use originally. So the more awareness about different drug options can help people contain the cost of them and allows them to get past unnecessary medical expenses. So today we first examined the high healthcare costs and the issues with them. Secondly, we went over some of the causes of such rises in prices. And then lastly, we outlined some solutions to help reduce the impact that these rising costs have on Americans. So affordable healthcare should not be a privilege reserved for people who can afford it.